Well, as COVID-19 vaccines continue to roll out in Indiana and throughout the country, a critical question looms. Can vaccinated people still spread the virus? A nationwide study is tapping college students to help answer that question, and Indiana University is the only college in Indiana to be part of that study. Business of Health reporter Kylie Valletta has more. Kylie.
Thank you very much, Gary. Because college students live in such close quarters, scientists say they're the ideal group to answer the question. While vaccines protect against serious symptoms, scientists are unsure if the vaccinated person can silently spread the disease to others. The answer will have far-reaching implications, including when employers could safely bring their workers back to the office. Here to tell us more about the study and IU's role is Dr. Christina Ludema, an assistant professor at the IU School of Public Health in Bloomington. Dr. Ludema, thanks for being on the show today.
Glad to be here.
All right, let's start with what we don't know about after you're vaccinated and why this question in particular is especially important to answer.
Yeah, so as you just mentioned, the research is really strong on the ability of the COVID vaccines to prevent serious disease and death, which is great news because as more people are vaccinated, that's translating into fewer deaths and fewer hospitalizations. And we also know that vaccine prevents asymptomatic disease, meaning that silent spread piece that you just talked about. And what we don't know is vaccination also prevents spread. And continued spread means that the push to get everyone who's at high risk for serious disease to get vaccinated is even more urgent, and we have more concerns about new variants coming into the picture.
Okay, so you say that college campuses really are great places to do this kind of research. Explain why that is and exactly what all of these college students will be doing.
Yeah, so they're a great population to do this research for three main reasons. They live with other people in dorms or with roommates, and so there's sort of a high concentration of people living together. They're really enthusiastic about contributing to the science to end the pandemic. I've been really pleased with the response to this research study. And thirdly, they're also tech savvy. So a bunch of the components that we have for data collection involve using your cell phone for sort of a daily diary situation, and it's going to be a good setup for that as well. And so in terms of what the students will be doing in the trial, they're going to be doing daily nasal swabs, they're going to do 3 blood draw visits, and then answer these survey questions using the app that I was just talking about.
Okay, so the results are expected in the early fall. What do you think you will find?
Yeah, our expectation is that the Moderna vaccine does prevent spread. So that's the vaccine that we're testing in this study. And that can shape our future conversations about what life looks like post-pandemic.
So IU has the capacity to enroll about 500 students total. What has response been like so far? I know this is brand new. And how many have you enrolled so far?
Yeah, so we're just getting started. We've got 8 participants so far, and gotten a lot of great enthusiasm. So looking forward to moving along.
So as you mentioned, this study relies on the Moderna vaccine. It's using the Moderna vaccine. Could the results translate to the other vaccines?
Yeah, our expectation is that with both the Pfizer and the Moderna vaccine would perform pretty similarly in terms of spread. Since they're both mRNA vaccines, we expect the results from our trial to apply also to the Pfizer vaccine as well.
So how do you think this study also helps translate to decisions all of us are making about life after vaccination? One thing we mentioned is employers. How does this help them decide when it's okay to bring employees back to the office?
Yeah, so the main concern with continued spread of COVID-19 is that, as I mentioned, there's going to be 2 pieces with that. One is the potential for people who remain unvaccinated to have serious disease. So for example, for an employer, you might have a person in your office who can't get the vaccine for really legitimate health reasons. If that's the case, for most vaccines, we're looking for this possibility of herd immunity, where everyone getting vaccinated protects those people in the population who can't get vaccinated. So again, thinking about those people who can't for health reasons. Also, small babies are in that category who can't get vaccines right away when they're small. So when we're thinking about the kinds of decisions that we can make post-pandemic, do you want to bring someone back into the office who has one of these health conditions and can't get vaccinated? If everyone in the office is vaccinated and the vaccines do prevent spread, you feel a lot more comfortable asking that person to come back into work.
And also, we have just a few seconds left, but explain just a little bit about how IU has a really great framework set up already to be part of this study. I think you said students really don't even have to see another human being for the study, except for like one interaction. All of this is done through the framework that you already have set up.
Exactly. So IU has been doing a great job with their mitigation testing setup. They've been testing many students on campus once or twice a week. And that framework is making it easy to answer the research questions because students are already coming in on a regular basis to do the SARS-CoV-2 testing. So in combination with the tech resources that we have, we know that we're asking a lot of our study participants, but not very many in-person interactions, as you just mentioned, Kylie.
All right. Well, Dr. Ludema, thanks so much for being on the show today, and good luck with this study. We'll certainly be following up with you to hear the results.
Great. Thanks so much, Kylie.
And Gary, back to you.